Hello, welcome to the skeletal chapter. So Mr. Manee is going to help us somewhat, but we're definitely going to discover within this chapter, and I'll use him for the skeletal bones here in a little bit, but definitely seeing the importance of when we think about the skeleton of a manatee versus a human. There's a lot of similarities that we're definitely going to see within the bones. So the first part definitely want to be thinking about when you think of the skeletal system is think about some functions, okay, so the physiology aspect. We know that, of course, the skeletal system is that bony framework consisting of 206 bones that are going to allow our body to be strong. So there's 5 main functions that happen within this system. First is the framework, okay, the framework for the body. Number 2 is, of course, protection. So we think of delicate structures such as obviously our brain and spinal cord would be a couple of the organs. Number 3, it's a lever system. Not going to get into in this video, but a lever system, of course, we're going to add the muscles into the next video and show how when the muscles move, that is going to, of course, cause leverage for the bones to be able to move. Number 4 is going to be storing calcium. Okay, so definitely view the bones as a bank, okay, that our blood is going to draw from when it needs calcium. Okay, so definitely think about the bones as a bank. Okay, so like you put an ATM card in, or go to your bank and pull money out, then think about if you take out too much money, you're going to be overdrawn. And number 5 is producing red blood cells. So another thing you need to think about will be definitely important when we get to the videos of the blood, okay, the blood cells, is there's marrow. Okay, there's marrow within our bones that literally keep us alive by producing blood cells, okay, especially red blood cells. Okay, when we get to talking about these things called erythrocytes, these red blood cells, once they mature, they cannot go through mitosis. Okay, so it's actually going to be another organ we'll eventually get to, the kidneys, that are going to tell our nursery, and the nursery is held within our bones, within the marrow. So very important. Okay, so I think most of us kind of the first 3 things we know. The last, number 4, yeah, calcium we really think of, but we don't always think about it being a bank per se, but we always think the calcium has to be there, but it has to be withdrawn by the blood because the blood's going to need it. And the last one we don't always think about is that blood cell, okay, the marrow within our body. Now, classification-wise, bones fall under different types and shapes. Okay, now there are technically 5 different shapes that we have as far as the skeletal system, as far as the bones. Number 1 will be, we'll spin and talk about here more in detail, is the long bones. We think of them being long, okay, longer than they're wide. So longer than they're wide. So in examples in our body, of course, a lot of our long bones, hence what we'll be talking about them, like our radius and ulna, our humerus, our femur, even our little fingers, our phalanges, okay, those are considered to be long bones. So know some examples in your body. The next one would be short. Okay, so short, of course, we think about cube shapes almost. So like our carpals or wrist bones, okay, would be an example that is listed. Even, other ones would be like your tarsals. Or tarsals are your ankle bones themselves. Now, a third category is going to be flat. Okay, so think about like in our cranium and our skull, flat bones. I think like our sternum would be an example of a flat bone. Number 4 would be, if it doesn't fall under one of those categories or a little bit of all, they just call me regular. Okay, so a good example on a regular bone would be like your vertebrae. Okay, has a little bit of flat, has a little bit of curve. Okay, too, we think about getting to the scapula would be any other kind of example of that. That's our in the back. And when we talk about our shoulder blades. And then number 5 is the only example we have really in the human body is a sesamoid. So number 5 is sesamoid, and that example would be your kneecap. Okay, when we think about the types of bone. So know some examples. Not a huge deal, but definitely want to know long bones. Okay, because we're going to talk about now the structure of those long bones. Okay, so those long bones have 3 different parts as far as the names of those parts, and 3 different coatings that go over those parts. Okay, so 3 and 3, okay, is the magical number to definitely be thinking about. So it makes up most of our system far as the appendages. Okay, when we think about long bones, okay, long bones themselves. Now the long, narrow shaft of a long bone is called the diaphysis. Okay, so the long shaft. Okay, so we'll look at my arm, my forearm here. Okay, the bones that are within that radius on thumb side and ulna. Okay, this long bone, the middle section, the shaft, is called the diaphysis. Okay, so the diaphysis. Now the ends, E for E, the ends of those long bones would be called the epiphysis. So D's in the middle, E's at the end. Okay, diaphysis is the shaft. Okay, epiphysis is at the end. Okay, so when we talk about the epiphyseal end of the bone, okay, also, of course, we're going to be looking at the name here in a minute, it articulates. Okay, and the word articulation means adjoining. Articulation means adjoining. Now, so we've got in the middle, the ends, and we have to crack the bone open. I'm obviously not going to do that, but we have to crack it open, okay? So inside of your long bones is where the bone marrow is going to live. So that's the hollow inside, okay? It's the hollow area called the mandibular cavity. So a couple areas you definitely need to know, okay? So diaphysis, again, the long shaft. Mandibular cavity is on the inside that holds the bone marrow, or MC, sometimes it's called. I think of the M, O to the M, okay, and then E is the proximal and distal, okay, depending upon what we're attaching to, epiphysis or epiphyseal ends itself. Very important. One thing to definitely be thinking about when you think of bone marrow, there are two different types of bone marrow, and it's usually found in kind of, we'll look at the differences of the consistency of the bones, of a soft, what they call kind of a spongy, okay, so it looks like a sponge with the holes in it, and then there is the harder part, which is more the ossified area. More usually we kind of find that more at the middle, okay, the body or the belly of our long bones. Now, red bone marrow manufactures blood cells. Okay, remember we talked about this being the nursery, okay, itself. Now, yellow marrow is the one that we usually find in the cavities of the long bones, but it's comprised of a lot of fat. And we think of babies, especially in children, that's definitely going to help with the manufacturing. Okay, so we think about, of course, obviously as we age, things change, but bone marrow is important to understand why we need it. It helps to make blood cells. Okay, so eventually when we get to the different types of red blood cells, white blood cells, and platelets, okay, those are going to be manufactured within the nursery of our bones. The coatings, okay, so diaphysis, okay, remember we talked about diaphysis, okay, that is going to be covered by called the periosteum or periosteum, okay, whatever way you want to pronounce it. I'll think of the OS in there, okay, the periosteum is going to wrap around. It's a tissue membrane that protects everything on that long bone except for the ends. Okay, so it goes all the way up to the proximal, end would be this way, or down to the distal, depending on which direction, obviously, and being in the anatomical position. Okay, so the periosteum or osteum covers the D. Okay, so PD. Okay, that kind of helps you put some letters together. Now the E's, the epiphysis, epiphyseal ends, that is coated by a membrane called articulate cartilage. Okay, or also known as hyaline cartilage. So it's covering the ends, articulate. Okay, so articulation means adjoining. Okay, so it covers the end, and that's going to be very important. We talked about ossification here in a little bit. Okay, so DP, okay, AE, okay, AE. Okay, articulate cartilage covers the epiphyseal ends. Now, if we covered the middle, the shaft, and we covered the ends, remember the last section? MC, mandibular cavity, we got to coat that lining inside of the bone, and that is going to definitely be your endostum. Okay, remember endo inside, so endostum is the thin membrane that lines the cavity. It's going to help prevent the marrow from leaking out, but it's also going to contain both of the bone cells, okay, osteoblast and osteoclast, that we're going to be looking at here in a few minutes. So hopefully, again, you got to know the three areas and the three coatings: diaphysis, periosteum, epiphysis, articulate hyaline cartilage, and then the mandibular cavity inside is going to be your endostem. Okay, got to know those membranes that protect. Remember the barriers that prevent things, of course, from getting in, but also prevents things from going out. Now, osteoblast, osteocytes, and osteoclast. If you see the word osteo, O-S-T-E-O, osteo means bone. Okay, our osseous, okay, remember that one back, connective tissue. So remember, the bones are connective tissue for classification. So osseous tissue is the hardest form of connective tissue. Okay, this is the one that definitely we think about is going to contain three different types. And I already said the names to you, cells. So remember, a group of cells equals a tissue, connective tissue in this case, that eventually makes the organ. Of course, the organs are going to be the bones. So blasts are going to be the ones that build up the bone. Okay, so a good way to help you remember this is Bob the Builder. Okay, throw it out there to Bob the Builder. Okay, so remember, Bob the Builder was about building things up. Okay, so think of the B for B. The osteoblast are blowing things up. They're totally opposite than the name. That's why I try to associate with Bob the Builder. They're building up the bone. Okay, so blast, build. Blast, build. That is important. You need to know that. Now, osteoclast are the opposite of that. Okay, they are responsible for a process called reabsorption. Okay, reabsorption is the breaking down of the bone. So Bob the Builder builds up, osteoblasts, osteoclasts break things down. Okay, so class, carve away. Okay, class, carve away. That's important. You got to know the differences between the two, because our bones are living cells, so don't forget that. Okay, we kind of, we see bones, and we obviously with the skeleton at Halloween time especially, we see all that. We don't always remember that the bones are constantly working. It's a yin and a yang that's happening within their body. Now, the last, the third one, are osteocytes, and these are just mature osteoblasts. So they're still osteoblasts, but they're a lot more mature, and they actually live and maintain the bone tissue within that area. Okay, so we're going to see they're kind of actually encased, and they can't go anywhere. They've taken up residence, okay, and they're their retirement home, you could say, per se. They just stay put, but they maintain that particular region, okay, within the bone. So osteoblasts are moving throughout the whole bone. Osteocytes just stay put. So again, mature versus not mature. Okay, they're not going anywhere as far as osteocytes. Now the bone, remember, when we think about back to some names, a matrix. Okay, so I've mentioned this word before, matrix, this intracellular material, literally the consistency and hardness reflects the material living between these bone cells. So remember, the matrix is like making a cake or a brownie, and you adding more or less eggs to make it thicker or thinner. Okay, so remember, matrix. Now the material is rich in our bones in collagen. Okay, we also have calcium salts. Okay, both of these help to maintain healthy bones. And even without minerals, we think about then the bones are going to start bending. Okay, never a good thing, but initially that kind of is a good thing, because our bones don't start off very hard. They're not what they call the word of ossified. Okay, so the word of ossified, okay, or ossification, is where that hyaline cartilage that covered the ends, okay, as we age, but almost all of our bones started off as cartilage. Okay, so kind of go back to that and remember connective tissue. So liquid, remember, then we got all the way to hard, but right before that was plastic. So our bones start off as a membrane of cartilage. Now, cartilage, usually by the second and third month in the embryonic state, that's where we start seeing that, again, that ossification start occurring, okay? Where osteoclasts remove that cartilage, they start taking away much, okay, away at the cartilage, and osteoblasts then start, like Bob the Builder, start laying down bone, harder bone, calcification on top of that area to kind of fill in those gaps, okay? And then eventually, okay, it becomes hardened, and the cells remain in that matrix, okay? Now, some of those cells then get stuck within that matrix. So you're going to see some names there. You got to know. So I got to know the 3 different types of cells. I got to know osteos, osteo means bone, blast, again, bond the builder, clast are the ones that, again, are carving away, help with reabsorption. Reabsorption of the tissue, and then clasts are just those blasts that are going to stay put. Now, the organization of a bone are little tiny units. Okay, so think of those Legos in some ways when you're building an individual Lego is called osteons. Okay, it has the word osteo. And this system is kind of like in a circular motion inside of all our bones. In the middle of that osteon, you're going to have a lamina, and again, that's just going to be a canal. Okay, that again allows the blood and veins to come through, allows the nerve system to again get to the cells. Because remember, cells have to have oxygen to stay alive. Okay, so they have to have a rich blood supply around them. Now, osteocytes, remember, those are the ones that eventually, as the bone is getting harder, that they get stuck within an area, but that's not a bad thing. Okay, they're going to maintain the bone within that area. So they get stuck in an area, in a home, and I almost like to visualize those osteocytes are living in a little like Hawaiian hut, and the Hawaiian hut medically is called a lacunae. Now lacunae is just a home that the osteocytes live in, but just like with any home, you need to have outside communication. Okay, now between those lacunae, those homes that the osteocytes live in, is a canal, and the canal is called canaliculi. I had a teacher many years ago, and I'll put a shout out to them. Can't remember their name, unfortunately, I'm sorry. But they called canaliculi, they always said, "Can I lick your eye?" I'm like, no, you cannot lick my eye, but I've never forgotten it, okay? So I always remember canaliculi are the canals between those osteocytes to allow them to communicate to each other. Because remember, we don't live in an island, okay? Our cells don't live in an island. They need to communicate via, of course, chemicals, okay? They're not like picking up the telephone and saying, "Hey, George, what's going on?" Okay, within that. So definitely understand the basics, of course, ossification. Okay, again, ossification starts in the fetal stage and continues through about like from 17 to 20 as far as the age from, again, it turning from cartilage to bone. And at the end of that process, what's going to be left is going to be just a little bit of a coating at the ends of the bones. Okay, sometimes it's called the, the epiphyseal line, the growth plate, growth line, sometimes it's called. That's that area we think about that they can measure in an x-ray to see whether we have stopped growing at that 17 years to 20 age. Now remember, all of this is controlled by a feedback loop. Okay, back to homeostasis. Okay, now it's directly controlled by calcium. Okay, so definitely understand the concentration of calcium in our blood helps to trigger, of course, our brain. That triggers certain glands in our body to regulate how much calcium is staying in our bones. Remember, it's a bank, and how much is leaving our bones. Now, I'm not going to get to it within this video, but this textbook I'm using, and a lot of textbooks, of course, talk a little bit about that feedback loop. The sensor, okay, the receptor that's going to receive, remember the 3 things from chapter 1 far as any type of set point is, remember, we have sensors that send the information to the brain, the control center, and then the control center sends it to an effector to make a change. In the bone case, the parathyroid, and even the thyroid, but more of the parathyroid is going to control that loop. Okay, so when the calcium levels drop, that information is sent to the brain. The brain then tells your parathyroid to release its hormone. When that hormone level goes up, a PTH, okay, so parathyroid hormone, then that causes the bones to start kind of breaking down. That sends then calcium to the blood, and the process is reversed, okay, with it. So definitely be thinking about homeostasis. In this case, definitely the osteoblast and osteoclast are told by the brain of, I need to work a little bit more, and I will need to work a little bit less. So think about Bob the Builder. If Bob the Builder is building up too much, think of conditions like osteoarthritis, bone spurs within that particular area. Then you think about the opposite of that, of osteoclast. Well, if I'm breaking down the bone in that area, conditions such as osteoporosis. Okay, so definitely understanding what osteoblasts and clasts do is vital to understanding the pathologies that come when one's working too much or one's working not enough. Okay, the problems, unfortunately, they do have to be in unison. Remember, everything in our body is about homeostasis. Now, when we're talking about the skeletal bones now, very important to know that there are certain markings, such as projections or certain depressions or holes, that we're going to find throughout the skeletal bones. Now, definitely you need to know what a region is on that bone, because when I get to the muscles in next video, muscles usually attach to these areas, especially the projections, okay? Muscle bellies, okay, the middle of the muscle belly likes to live within the depressions itself. So, such as like a head, okay, head's like a knob, okay, that separates the rest of the bone by usually the neck, okay, think of your head and your neck, so again, attachment points will be important for that. Words such as processes, okay, that's just a large projection that comes off the bone. Condyles and crests and spines, okay, so definitely make sure you go through, like a condyle then is like again, a rounded projection that comes off of it. You might have an epicondyle, a crest, again, as a ridge, and then we think of a spine like that, very like, you know, your shape of your shoulder blades, a sharp projection that comes off of it. Now, the depressions or the holes, or foramen, you definitely want to know that one. So a foramen is a hole that allows either a nerve or a vessel to pass through between the bones. Okay, so like the foramen magnus, okay, that's the large opening that allows your spinal cord and your brain, okay, to continue on. A sinuses, okay, a hollow cavity, okay, definitely think about the sinuses of our head. Fossas, okay, fossas are depression, okay, that's where the belly of the muscle, a lot of muscles like to live. And then a meatus is usually like a kind of a short opening, a canal, like we have a meatus in our cranium that goes to our inner ear, okay, itself. So knowing these projections is going to be important, okay, as you're going through them. Now, bones, Manee. You do not have 206 bones, okay? So Manee is going to help us a little bit, but I want to touch parts and regions of the body, okay? So that is important for you to know. You've got to touch these areas. You've got to get you a little baby skeleton and touch those areas right on a skeleton. Okay? The more you touch, the more you move the areas, you draw a skeleton, the better it's going to come, because when you add muscles on them, you've got to know the names of the 206. Okay, so 206. Okay, 206. Now the good thing is there's not 206 names, but you definitely need to know the names, and a lot of them come in pairs, okay, itself. Now the human body is divided into two different, what they call parts or regions. Okay, axle, so AX system, skeletal system, which composes of the core of your body. So AX consists of 80 bones. So out of the 206, we have 80 bones, and those bones are going to be bones of your skull, your rib cage, your vertebral column, inside your ear, and one other bone that's the only bone that does not join another, your hyoid bone. So 80 bones that we're going to look at just of the axoskeletal system. Now the second part is appendicular, adding on to that. Okay, so if you know the 80 bones here, everything else, okay, which are your arms and your legs, those are appendages, extremities, limbs that add on to this. So appendicular, there is 126. You got more bones in your arms and your legs than you do your whole core part of your body. So clavicle and scapula and arm and forearm and hand. The lower extremities will be your pelvis, your thigh, your legs, and your feet. Okay, so know the bones. When I talk about, you know, AX, axial skeletal system, we're going to talk about those bones. You got to know those bones. Okay, then if I talk about the, which I will, appendicular, you got to know the bones within that system. But again, Manee, he'll help us somewhat until we get to the legs, because you don't have legs, you just have the flipper. Okay, so when we get to that part, of course, we think about cartilage and stuff like that. But they have a lot of similarities when we think about manatees. So label the bones. Okay, I know it seems kind of daunting as you're going through it, but it is very important that you got to know these bones. So let's start with the cranium. Okay, now the skull itself has two different parts to it: cranial or cranium bones, which are 8 total, and then the other one are facial. Okay, so 14 facial in your skull, 8 cranial or cranium bones. Now I'm going to focus on a few of them, obviously the ones we could touch more. I'll mention the other ones. They're more internal, can't touch them, but most of those facial bones help with your nose, okay, as far as the attachment points for muscles. Okay, we'll talk about muscles in next video. So of the 8, let's touch them. Okay, we'll use Manee too. Frontal is your forehead. Okay, so your frontal bone is your forehead. So touch your forehead, okay? Cranium. So cranial bones. So forms your forehead, a little bit of your nasal cavity. So that's your frontal bone. Now parietals are the ones on the top of your head. I know it's kind of hard for him, so I'll touch myself, but it would be up here on each side. Okay, so his frontal would be here, okay? Parietals are at the side, a little bit further back there, the most superior of your head, okay, of your cranial, your skull. So parietals, there's 2 of those bones, a left and a right. So frontal parietals helps to form the superior and the lateral portions of our cranium. Now number 3, as far as the list, is the temporal bones. Okay, think of your temporals at the side. Okay, the temporals at the side. It's a huge bone because it actually covers the whole area, definitely where your ear and stuff is. That's the temporal bones. So touch them. So frontal parietals, you got 2. Temporals, you got 2. Now number 4, as far as what you can touch, is the occipital. So occiput, okay? The pit's in the back, P-I-T. Okay, it's in the back. So that's the one that's the most posterior and inferior as far as the cranial bones themselves. So frontal, parietals, temporals, occiput, okay, or occipital. Gotta know those. So those are the 4 main ones. Now the other 2 are deep. Sphenoid bone is the one that kind of looks like a, when you look at a cranium, it kind of looks like almost like a butterfly. Okay, it connects all 4 of the bones. And then last is the ethmoid. Ethmoid is the one that's like the medial portions, okay, of your orbits, which are your eyes, and a little bit of the roof of your mouth. Okay, so it's very, very deep. So that's the other 2 that you definitely want to know of the 8 cranial bones within your cranium. So once you get that down, then there are 14 facial. Now let's talk about the 2, the one that moves. The only one that moves, should be moving, first freely moving, and it's going to be a synovial joint in your head. Okay, so facial is mandible. Okay, so he has a mandible, it's his mouth. Actually, you don't have a mandible because this one doesn't move, but manatees have mandibles. Okay, they eat with, that's your jaw. Okay, so the lower portion of your jaw is your mandible. Right above that, where your upper teeth are at, that's your maxillary. Okay, so mandible would be here. It's the only freely moving bone in your skull. So these are facial bones. Maxillary's up here. Okay, again, you have a left and a right. Now palatines, if you were to open up your mouth, the hard palate, like when you touch your tongue to the top of your mouth when you're talking, that's your palatine bones. Your zygomatic are your cheekbones. Okay, so touch, like if you see these ladies that like to carve them and they like lift their, all that up. I don't understand why, but that's your cheekbones, your zygomatic. Your nasal bones, your lacrimal bones, your vomer, and your conchi or conchi, those 4 together help to form your nose. So those are the deeper ones, okay? So you have a right and left nasal bone, it's like the superior portion, okay, the bridge of your nose. The lacrimal, you think about, of course, helping with the lacrimal, they're really deep, where your tear ducts are located. You think about your septum between your nose, that's your vomer. And then the inferior conchi or conchi, depending singular versus plural, those help to form the cavities, okay, within your nose. So main ones, jaw, mandible, maxillary are the 2 that you definitely want to know first facial. Okay, the rest of them help to form like inside your mouth and inside of your nose themselves. Now there is also in this region, okay, so we think about the skull is soft spots, okay, fontanelles, okay, babies, okay, that these bones in the skull, the big ones, okay, we think about the cranial bones, were separated, okay, they were not completely together, so hence why there's a hole, literally, a membrane just protecting your brain from the outside world. Now, as we age, and they usually about 6 months, the larger ones up to 18 months in an infant, okay, or a child at that point, as far as classification. Usually they will come together and usually lock like this. Sometimes they butt up against each other, but they're interlocked, okay. Those bones usually fuse together, and then that name turns from fontanelles, would be the name that you'd want to use, because the fontanelles are sutures, okay, at that point when they completely come together. So soft spots are fontanelles. When they completely fuse together, then they're called sutures. You think about when you're suture, you're sewing something together. Now, there's 2 other bones in the cranium that we want to talk about. Mention them now. I'll get to them in more detail in later videos when we talk about the senses. In each side, okay, you have 3 bones called ocellates. Okay, so your ocellates are going to be in your middle ear. Okay, in your middle ear, in both sides, you have 3 bones called ocellates. Now, the only bone that does not join, touch, connect, articulate to another bone is one called the hyoid bone. Okay, so the hyoid bone is definitely a bone that you want to be familiar with, that name. The hyoid bone itself is one they look for, usually it's broken during a strangulation. So Mr. Skeleton is going to help us with this section. I'm going to use my pointer to kind of point out the areas. But again, get you something, a little tiny skeleton. I got this one from the Dollar Tree, so you have no excuse to not go somewhere and get you something cheap to help you in your tactile learning. Because remember, if you touch it, you talk about it, you draw it, it's going to stay in your brain a long term. So areas we're going to talk about are the skull first. Okay, so the skull first. So remember, the skull has 2 different regions. One is called the cranium, okay, the bigger bones, and the smaller bones are called the facial, okay, bones. So frontals on the front, okay, frontals on the front. And I'm going to go through these pretty quickly because I would have already talked about these on the human body, even use Manee a little bit, so I'm going to go through these pretty quickly, but still use a little skeleton to help us. So frontals on the front, 1 bone, parietals on the top, so parietals on the top, 2 of those. On the sides we have the temporals, so sides and the temporals. And if we were to turn his head around, and I will so you can see it, it's kind of creepy to think we can't do this, would be on the back, would be the occiput, okay, or occipital, sometimes it's called. Okay, so know those 4 main bones that are cranial bones. Okay, and you kind of notice even the sutures between those bones that connect those would have been the fontanelles, the soft spots. Now, bringing him back around so you can see his head again. Turn him just a little bit more so you can see his face. Looks all creepily at you. Now, there are 8 of those cranial bones and then 14 facial. Now, the 2 main ones you need to know for facial is the jaw. So the jaw is going to be, the lower portion is called the mandible, and the maxillary is the top portion. Okay, you have 2 bones there, left and right. The rest of those help to form this region, your nose. Okay, so definitely look through the rest of those. Cheekbones would be zygomatic. Okay, zygomatic are your cheekbones, and then such as like your vomer, nasal cavity bones themselves. So 14 total. Again, they come in pairs, most of those. So the next section, moving on down from the head, which he definitely has, but you have less of these, is going to be vertebrae. Okay, actually lesser and more in other areas. So vertebrae, your vertebral column, better known as your spine. So the vertebral column, your spine, aka your backbone, has 26 as an adult, irregular, remember the shape, vertebrae. Okay, now again, as a child, usually 33, 34, because your sacrum and your coxal, okay, actually those were separate bones as a kid. So let's look at some numbers here. Okay, so cervical, you have a total of 7. Okay, so 7 in your neck. Okay, so cervical refers to the neck region. Okay, that is very important. You definitely want to know that far as regions. Okay, the vertebral column itself. So C1, C2, C3, C4, C5, C7. Okay, those are the names of the individual. Now the first two can also be called the atlas. C1 can be called the atlas, which supports your head. Okay, your head literally lays on that vertebral column. And then we think about, the atlas of the mythology. Okay, and then axis, A-X-I-X, is C2, and that's the one that's the pivot that allows you to turn your head like, I don't understand what you're saying. Also, we'll look at, of course, saying, yes, I understand. Okay, so again, that turning type of motion. So C1 through C7. In some books, it also talks about C7 can be called the vertebral protrudence. Okay, so like if you follow it down to that little area that points out, okay, that's going to be C7. Okay, so again, the spine, the vertebrae. Now, T1 through T12, so T1, 2, 3, you kind of get all the way to you get to T12, that's the thoracic. Now, all of your ribs are going to attach in the back to your thoracic vertebrae. So 7, 12. After the thoracic, our next one is the lumbar region. Okay, so the lumbar region, we have a total of 5. So 5 lumbar, they're the biggest and the thickest of our vertebrae, okay, because everything else is being pushed down in the lumbar region. So as far as numbers, 7, 12, 5, okay, and then the last two are going to be sacral, okay, sacral vertebrae. Now it's 1 in an adult, but it's actually 5 separate bones as you are aging as a child, okay, itself. So sacrum, an adult, and it's right between on each side is going to be your pelvis, okay, your hip bones, okay, on both sides. It is 5 that fuse together as an adult, hence why kids are more flexible than us as adults. And then the little rattler is a coxilli or coccygillus, okay, sometimes called coccygillus. That is going to be, again, 4 in a kid that fuse together, that little rattler, okay, so a coccygillus, okay, or your tailbone in an adult. So again, number-wise, when you're thinking about sacrum would be 1, coccygillus would be 1 also. So that would be your last 2. So primary curves, again, start with thoracic and your sacral. Okay, those would be your primary curves. The secondary curves, okay, would be your cervical curve, convexus, okay, and then your lumbar region goes backwards. Those are the curves. So that's the back. Okay, in the front we have the ribs. Okay, so you have a total of 12. Because remember, on the back they attach to the thoracic vertebrae. So count the 12 down, kind of fill them. But you got to start up with this bone where it's not part of the axoskeletal system. It's part of your appendicular. Okay, but this bone here called your clavicle, right below that is really where your first of your 12 ribs attaches. And the very front of that, in your thorax region, okay, is going to be the bones in this region of your sternum, and then of course the ribs attached to that. Okay, so sternum's on the front. Okay, definitely want to know that when you're thinking about the sternum. The most superior portion of your sternum, okay, between where your collarbones, your clavicles will attach, is your manubrium. Okay, manubrium is literally joins laterally on the right and left these collarbones. Okay, and the name comes from handle. So like the top of your sternum is where the handle would be. The point of the manubrium, where the clavicle joins, is a notch. So there's actually a notch that you actually will see where the bones of your clavicle meet up with your sternum. And then of course as you go down, you have the body in the middle, and then the little part that you'll push off and break if you do proper CPR is the xiphoid process. Now the ribs attach on the front. Not all 12 of them attach to the sternum. Now the first 7 of them, okay, the first 7 are what they call true ribs because they directly attach to your sternum. So the first 7 are called true ribs because they attach to the cartilage on your sternum. The rest of them attach to that cartilage to attach to your sternum, except for the last two. The last two don't have any. So they're called floating ribs. 11 and 12 of the 12 are called also floating ribs because they do not directly attach at all. So 1 through 7 are true. 8, 9, 10, 11, and 12 are also, they're called false. Okay, so 8 through 12 are called false. 1 through 7 are called true, and the last two can also be called floating, so 11 and 12 themselves. So between these ribs is a space called the intercostal space. Okay, those relate to the areas where we'll attach muscles, blood vessels, and nerves will innervate those regions. The next region we're going to talk about, the vertebral column. Okay, so the vertebral column, I'll turn him around here so you can see him. All right, the next part we're going to turn around, and I've faced him to the side so you can see it, but this is the posterior portion of him is the vertebral column. So the vertebral column are 7, C1 through C7 is the cervical region. So that is the neck. T1 through T12, all these ribs that will be attaching on the back, there's 12 pairs of ribs. So T1 through T12 is the thoracic region. This region here is the lumbar, so L1 through L5. So we have 7, 12, and 5. And then sacrum and coxae, or coxil, sacrum is 5 in a kid that fused together as an adult. And then one of the little rattler, the tailbone, would be the coxae or coxilli or coxilli, depending upon the textbook. That would be 1. So again, 7, 12, 5, 1, and 1. Now one last part here. Sternum. Manubrium is at the top. Body of your sternum, and the xiphoid process is right here. And then all these ribs, you have a total of 12 on each side, 12 pairs. Now the first one is underneath a bone called the clavicle. And the clavicle is where you would find T1. Okay, so going right straight back, but on the front, that is going to be your first rib. So when you count them down, 1 through 7, those directly have cartilage that attach to your sternum. So 1 through 7 directly attach to the sternum. The rest of those, except for 11 and 12, don't directly attach to the sternum. They attach to the cartilage on 7 to attach to the sternum. So T1 through to T12 on the back, okay, they all attach. On the front, where the sternum's at, only 1 through 7 on each side attach to the sternum. 8, 9, 10 attach to the cartilage of 7, and 11 and 12 on each side do not even attach to the sternum. So true ribs 1 through 7, false are 8 through 12, and then 11 and 12 are going to be called floating also. So they're false, but they do not directly attach at all to your sternum. Now the next bones we're going to talk about, which you have flippers. Okay, so you're going to have a few of these bones, Manee, that you can help us with. We're going to talk about is going to be the appendicular. Okay, so remember 126. So the bones before that you would have seen, and the little skeleton guys, those would be the bones of the AX axial skeletal system. Now we're talking about the appendages, okay, the appendicular skeleton. So it's going to consist of scapula and clavicle. Okay, scapula and clavicle. Okay, so your collarbones, touch your collarbones. Okay, these are your clavicles. Okay, the clavicles. So they attach to the axial skeletal system at the sternum. So sternum is AX. Clavicles, collarbones here are AP. Okay, appendicular system. So those are there, and then the ones that you can feel here, the acromion process, and then the back, we think of our shoulder blades, that is your scapula. Okay, that is your scapula. So you can kind of, when you touch back here, you'll touch your scapula. Can't really go through here to touch it, but it is back there. Okay, it's that irregular, weird-looking type of bone. Now, some names you definitely want to know when you're thinking about scapula And the clavicle region is coming off of the shoulder girdle. Okay, so those two bones are names of bones. Okay, actually you have a total of 4. Okay, so you have 2 scapulas and 2 clavicles. Those bones come together what they call the shoulder girdle. Okay, so this is your girdle you need to know. Okay, so scapula you have 2, clavicles you have 2. Okay, those come together to make up your shoulder girdle. Now, on the scapula, a couple names, some fossas, okay? So supraspinatus, infraspinatus, okay, or a couple of these little depressions will have some muscles, your rotator cuff muscles that we'll look at in the next video that live in this region. An area called your acromion process. Okay, that's the process that helps to join up. So right in here, and you can kind of feel it when you fall off of the AC joint, as it's called. Okay, that's going to be very sensitive. Okay, it's going to help, of course, attachment point for muscles. That's also an area that you need to be aware of. Okay, that process joins with the scapula. You can feel it as its highest point on your shoulders. Below that is what they call the glenoid cavity. Okay, so if you kind of fall down from that. And again, that's going to help with that ball and socket when we're going to join our humerus here in a second. So some areas you definitely want to know, okay? More of these bony, again, protrusions or depressions will be important when we talk about muscles in the next video. But go ahead and know which bones the acromion process, especially in the glenoid cavity, are going to make scapula, okay, scapula itself. So let's move on down then. Okay, so again, this would be his shoulder girdle. Okay, if he was to have a clavicle, collarbone, and the scapula. Okay, then right below that is going to be your humerus. It's the only arm bone. Okay, so your humerus is here. It's your only arm bone. Meets up with your scapula. Okay, humerus meets scapula. That's important. So right below that are our forearm. Okay, so forearm. Okay, so humerus meets the 2 bones of our forearm. Now be careful being anatomical. Obviously it's hard to do it like this, so I'll have to turn it, okay? But then I'll turn it this way so you can see the back side, because that's important with direction. Okay, so remember, medial versus lateral, okay? So on the thumb side, that's lateral, is going to be our radius, okay? So a radius is going to be a forearm muscle area. Arteries, veins, okay, we're going to talk a lot about your radial or radius region. You need to know it's on the thumb side. That's important. Ulna is on the pinky side. Okay, so ulna is on the medial side. Radius is on the lateral side. Remember, you got to be, and the thumb rolls over the ulna. So when you think about attachment points, the humerus distally attaches to your ulna and just your ulna. Your radius attaches to your ulna and does this, it turns over your ulna. Okay, so when you're hitting your funny bone, you're actually hitting the head of your ulna. Okay, the head of your ulna itself. So again, know some parts. Okay, it's very important. So when you think about ulnar, this, notch, okay, obviously, humerus meeting, okay, so some areas you definitely need to be familiar with, again, those bony landmarks. Now moving on down, so shoulder girdle, clavicle, scapula, humerus, forearms, okay, ulna and radius, and then your hand, okay, but before you get to your hand, you got to connect the forearm. Okay, so right here in this region are the carpal bones. Okay, there are 8, 2 rows of 4 each. Okay, so 8 bones. And I kind of shorten them a little bit to kind of help you. So the ham, the pis, the tri, the lune, the trapezoid, there's another trap, the cap, and the scaph, okay, or scaphoid for long. So not a huge deal, a lot of, including me, when I'm doing testing, I don't get into a lot of testing in the individualnesses of the carpal bones, but definitely start being familiar with their names. There are 8 of them total, okay, as far as wrist, your carpal, so you think you drive with the car. Okay, it's very, very important. So moving on down then from our carpals to our hand, okay, the palm of your hand are called your metacarpals. If you get how many, just count your fingers, because you have palm of your hands, you have 5 metacarpal bones. And then your fingers are called your phalange or phalanges. So the individual bones in all of these. Now you can count them by looking at the little lines. Okay, so you notice there's lines that separates the bones. You have 3 little phalanges in each finger, except for your thumb and actually your toe. You only have 2 bones. 14 bones in your fingers. Okay, of course we'll look at the feet are going to be actually the same too. But metacarpals, okay, and phalanges. I definitely need to know some numbers, and where they're located will be important for as division. So the next part we're going to talk about is the appendicular system. So the appendicular system are going to be the parts that attach the arms, upper extremities, and then the lower extremities to the core part of the body. So clavicles, you got 2 of them, and 2 scapulas. Your clavicles, I know he doesn't have any. Okay, so the clavicles are on each side. And then on the back, you have these scapulas. Okay, so 2 scapulas, and then on the front are your clavicles. Those 2 make up your shoulder girdles. At the tops of your scapulas are called your acromion process. Okay, so it is right here. Where your humerus meets your scapula is called the glenoid fossa. And then the next parts are your humerus, your arm bone. On your thumb side, I'm going to turn his arm here so he'll be in anatomical position, if I can. Humerus, arm bone. Thumb side in anatomical position would be your radius, radial. Ulna is on the pinky side. So humerus meets up with the scapula. The humerus joins the ulna to make up your funny bone when you hit your elbow. So that's the elbow joint. Again, think about proximal, proximal, proximal. We've been proximal in our fingers. So think about the bones that are closest going this way meet up with the distal portion of the next bone. So proximal meets distal. Proximal of this bone meets distal end of your humerus. So your elbow is your distal humerus meeting up with your proximal ulna. So very, very important. You got to know direction too, so be careful with those. So your radius and ulna then meet your wrists, your carpals. Then your carpals meet your metacarpals, palms of your hand, and then your individual little phalanges then meet up with your metacarpals. So phalanges, metacarpals, carpals, ulna, radius, humerus meets up with scapula, and scapula meets up with clavicle. So that's your upper extremities that you definitely need to know. Now this next part of the video, you're definitely going to see that I am going to use the skeleton only for the bottom half, obviously since I'm seated, to make it a little bit more easier for you to learn. So we're going to be looking at your pelvis, your hip. We're going to be looking at your thigh region. Okay, there's 1 bone of your thigh, is kind of like your arm. There's only 1 bone in it. Look at your leg. They should call it the foreleg. Okay, your tarsals, which is your ankle, so it's kind of like your carpals, except it's down there because you step in tar. It helps you remember. And then your metatarsals, okay, the soles of your feet, and then your phalanges. Okay, so definitely, hopefully that this next part can be helpful for you to learn it by actually seeing it on the skeleton. Put him in a side view to help us to look at the lower extremities. So, hip coxal, C-O-X-A-L. So coxal are your hip, okay, your hip bones. Now, the top part of your hip region is going to be called your ilium. Okay, it's also called the iliac crest on your hip. So the top portion of your hip, coxal bone, you have 1 on each side, is called your ilium. The back, that sticks out portion of your hip bones, coxal bones, is your ischium. So ilium, ischium. And the very front portion is called your pubis. So ilium, ischium, pubis. Got both sides. So remember, those three areas, regions, are going to come together to meet your femur itself. Okay, so it's a ball and socket type of joint there. So definitely think of iliac crest, ischium's at the back, pubis is at the front. All three of those bones come together, and they actually are three separate bones in a kid that fuse together to become an area called the acetabular joint. Okay, so acetabular is this region right here where the head, the ball of the socket, okay, ball and socket joint here. So when your femur meets up with your hip, it's meeting up at the acetabular region. That's very, very important. You got to know some landmarks. Now, femur is going to be your thigh bone, not your leg bone, your thigh bone. Now, there is a protrudence that you're going to feel on that, okay, a big giant little thing that sticks off right here called your trochanter. You have a greater and a lesser trochanter. Okay, so feel at the side of your body, the lateral portion of your thigh region, right past your hip, you're going to feel it. Now, to kind of help us, remember, pelvis, coxal bones on each side are going to meet up with your femur at the acetabular joint. This protrusion that comes off of your femur is called the greater trochanter. Definitely need to know that. So greater trochanter is here. So when you're thinking about attachment points for the lower extremities, your appendicular system, remember the vertebral column, more precisely your sacrum, meets up. That's part of your axial skeletal system. Your hip, pelvic bones, coxal bones, those are a part of your appendicular. So that's the joining right there, the joint, the SI joint as it's called, of where these two bones of appendicular are going to meet up with your sacrum, which is a part of your axial skeletal system. Moving on down in this position, you're going to see then the knee joint. Okay, the knee joint is where the femur meets your tibia, is the big bone, in the medial, and then on the lateral side, he doesn't actually have one, unfortunately, and the lateral side is going to be your fibula. So tibia and fibula. Okay, tib is the big one. Fibula, like a small fib, is on the lateral side. Now the next region you're going to see is the ankles, okay, better known as your tarsals. You have 7 of those tarsals. So 7 of those tarsals. The top one that meets up in between your tib and fib, between those two, is called your talon. Then you have a navicular, 3 cutiforms, and a cuboidal. Okay, so 7 bones, and the biggest of those, and I'll flip his little leg so you can see it, maybe, is this bone here called your calcaneus. Okay, so 7 bones within your ankle region. The largest of those tarsals is your calcaneus, aka your heel. Then just like in your hands, you've got a metatarsal, which are the soles of your feet. You have 5 of those. And then your phalanges, the same numbers like you have in your hand. So your hand is pretty similar. So hands are carpals, feet are tarsals, okay? Carpals are your wrist, tarsals are your ankle. Metacarpals are your hands, your palm of your hands. Metatarsals are going to be the soles of your feet, and the phalanges are your toes and your fingers. Okay, they're phalanges, far as plural. Now, I'm going to go ahead and talk about the joints. Now, the joints are any articulation that happens between any bone. It could be 2 bones, 3 bones, or such, okay? Now, remember, there's only one bone in the body that does not articulate or has a joint, and that's the hyoid, okay, the hyoid bone itself. Now, articulation and joining, again, of those 2 or more bones, they do classify them as movement, as far as classification. Okay, so the one that does not move very much is called a synarthrotic, okay, or rhosis type of joint. Those are the ones in our head, okay, when you're thinking about, okay, so sutures in your skull are considered for classification as far as the little to no movement. We definitely don't want these bones moving, except for obviously there is one bone in the skull, okay, that we definitely can move. Now next is amphothrosis. Okay, so amphothrosis is going to be areas that have a little bit more, they usually have cartilage in that area, such as your pubis symphysis, so they're in between that hip on the front. You're going to have a little bit of cartilage there that allows, of course, it expands some movement, especially for a woman when you have a baby. And in between those discs, in between the vertebrae, that would be an example of a synarthrosis type of joint. But most of the joints within our body, you definitely need to know, are what they call diathrosic or diathroses. That is referring to freely movement, okay? Now they do classify that even more into the type of joint that it could be at a synovial joint. Okay, so definitely know that word of synovial. Synovial, again, is a bone that's freely moving. It has ligaments, okay, again, connective tissue, dense, okay, connective tissue that helps almost like a spider web. So ligaments help to give more stability to bones. And also we definitely think about there's a capsule there. Within that capsule, you're going to find synovial fluid. Okay, so if you make a popping sound, okay, anywhere you can make a popping sound is going to be that fluid, the air within that fluid that you're definitely going to see. You also can find within this a lot of those areas too, little small sacs called bursae. Bursa is going to help kind of cool down areas that we move a lot. So you think about, of course, shoulder joints and hip joints themselves. Now, movements at these synovial joints are vital. Okay, so again, most of the joints in their body are diathroses or diathrotic. Okay, they're synovial joints. Okay, that's important to definitely know. So when we're thinking about movements, you've got to know these movements. So flexion and extension, got to know the definition of that. Abduction, adduction, so AB and adduction. Circumduction is kind of a circle, okay, so rotation is also, it can be called. Dorsiflexion, plantar flexion. Eversion, inversion. And pronation and supination. So use this next part of the videos for me showing you the actions so that way you can see the synovial joints of what is happening when we get to muscles. So a muscle will do flexion of a certain bone when that muscle contracts. Now, so when you get to the muscles, it's going to make a little bit more sense. I want to use movements of my forearm and my hand in relationship to my arm to help to demonstrate these actions. So flexion is a bending, a decreasing at the joint. So this would be flexion. Extending is a lengthening, an increasing of the angle, okay, between two parts. So this part versus this part, you notice that this gets closer. That's a decreasing, though that's flexion. And you notice that this part and this part get further away with extension. So think about areas of your body. You can do these throughout your body, like your hand, flexion, extension. Think about your head. Okay, you definitely, so your hand, flexion, extension, your fingers, you can flex and extend. Okay, so again, it's just an increase or decrease of that area. Now, the next one is abduction, abduction. So AB versus AD. So the next one is AB versus AD. So AB is a taking away, AD is adding. So going closer to the midline. So AB is abducting, taking away. AD is adding or even going past the midline. Okay, so AB, AD. Now, circumduction is just like rotation. Supination and pronation is just a turning away. So anatomical position, when I soup, I hold soup up, so supination. Pronation is where I turn, and it happens right here at your radius and ulna. Okay, so when you're turning your forearm, that's supination, soup up. Pronation is down. Just happening here. So that action, pronation, and supination only happens between your ulna and your radius. So the next movement relates to just at your ankle, okay? Eversion and inversion. Okay, so then your foot going inwards, the soles of your foot going in. Eversion goes out. So think E, the X goes out. In, out. Only happening at your tarsals. Now plantar flexion goes down. You're planting your foot down. Dorsiflexion goes up. Just at your ankle. Plantar flex, point towards like you're planting your foot down to give gas to your car. And then dorsiflex goes up. Toes towards the ceiling. Now this last part I will talk about within this video are disorders that affect the system. So some pathologies you need to start being familiar with. Some, main common words you might already know. Unfortunately, you may have some of these disorders, but you need to know what they are affecting. Okay, so the first one are disorders of the bones. Okay, so disorders of the bones. So we think about the bones, we're thinking about all that axle or the appendicular system that we've talked about. So they're called metabolic diseases, okay? So usually it's a lack of bone formation, or it could be osteoblast or working too much, or osteoclast or also working too much. So again, then not evenness. Or tumors, infections, something structurally, or even a fracture that could occur. So the metabolic disorders are things like osteopenia, osteoporosis, okay? This could be, again, where, again, there's more of a breaking down of the bones, okay? A lack of, again, the calcification, the ossification, okay? That could be happening. Now, other ones could be deformities or itises, so I-T-I-S, okay? So again, excessive activity of the osteoclast. Breaking down those bones. Now tumors, okay, so definitely think about, of course, you can see the osseous or osteo, that's going to relate to bone cancer. Infections, you're always looking, of course, like even conditions such as tuberculosis, okay, can spread to your bones. We were talking about a bacterial infection, and that, of course, directly can cause an itis, a condition such as pot disease. Now, structurally wise, those would be, of course, obviously where we have like scoliosis, too much curve from one side. Okay, so that's a side to side with scoliosis. Lordosis, okay, more of a straightening of, again, those lordotic areas. Okay, when you think about the natural curves, okay, so affecting the secondary curves. And kyphosis affects the primary curves. Okay, so again, kind of jutting out the neck, that would be a kyphotic type of extension of that particular region. Fractures, then you think about bones. Of course, obviously there are different types of fractures, such as a closed fracture. Again, that's any type of break in the bone itself, usually caused by trauma. A closed fracture would be, again, with not breaking through the skin, where an open fracture is going to be opening to the outside world. So there's a huge list. It kind of shows like what a green stick looks like, impacted, spiral, transverse, okay? So obviously directional is what they look for with any type of fractures. Now the next part, if we affected the bones, now we need to look at the accessory, okay, technically, which is going to be your joints, okay? So joints, again, are very complex. Stress would be the first type of mechanical injury that can affect a joint, such as dislocating the joint, the joint is no longer together like it should be. A sprain is where we have a tearing of the ligament, okay, or maybe a twisting of that. Okay, so like you say, I've turned my knee or turned my ankle bone. Okay, that would be a sprain. Bursitis, so itis, so that's of course an inflammation of the bursa, and that can limit your range of motion. And then you get into some vertebral disorders. Okay, this could be such as a herniated disc. And again, those bones we talked about, the spine, again, there's cartilage involved there. So anytime that you're damaging that cartilage, think of it being like a jelly donut when we think about your disc. Okay, so when we're thinking about disc injuries, first herniated disc, slip disc is the jelly within that bone that's kind of leaking out, okay? That space between your vertebrae is so important because there's nerves that go past that. So if there's a nerve that's going near that and I lose the jelly out of my donuts and that bone squishes that nerve, that's where we're going to have that severe pain that comes with, such as like sciatica. Okay, it's a good example of a herniated disc. Arthritis, which is kind of a generic term. Okay, remember arthritis means literally inflammation of the joint. Okay, so any joint within the body. And there's different types of arthritis. This is osteoarthritis. That's where you get that degeneration type of joint disease that's happening. Again, that cartilage, again, bone on bone. Okay, that's broken down. Rheumatoid arthritis is usually more kind of a swelling, okay, at the fingers and elsewhere in our body where you have that, of course, inflammation always comes with swelling, but it's more severe. You could get into infectious arthritis. Okay, again, that would be the bacteria that gets into the blood and then goes to a joint and colonizes. Okay, and of course, septic we know can be very deadly. And then gout. Okay, gout is a kind of arthritis. Okay, but it's more affecting, of course, metabolic. As far as there's a buildup of waste of uric acid that we got to get rid of, and maybe we got kidney problems that kind of add to that, and that is not getting enough of that acid out of our body, and then of course it's affecting and destroying and causing inflammation at that joint. Now, I'm not going to get into this video, but obviously there's ways that you can repair the joints. Okay, so definitely kind of look through that to understand, that far as these disorders, there are, ways to have like knee surgery. Okay, obviously anytime that we've had some type of injury at the bone or the ligaments, okay, that is directly going to affect the stability, the structural aspect, and that we have to add some change to that, either the use of synthetic, products into our body or drugs that help to bring the inflammation down. So hopefully within this chapter you have gotten the 206. And again, Manee didn't have that many. He helped us with a lot of the parts. So obviously they have very similar to us of having the skull, having the vertebrae, having the arms, okay, or upper extremities. Didn't have to worry about the lower extremities with him. But take some time, again, get you one of those skeletons or use something, making sure that you're touching the bones and talking about them, and even those movements, so when we get into future videos, it will be easier to connect the muscle to the bone. We look forward to seeing you all in the next video.